Hello, and thank you for choosing Coventry as your healthcare plan. Throughout the year, you'll receive important documents related to your Medicare coverage. This presentation provides an overview of helpful information and tools to use after you enroll, including your member ID card, the explanation of benefits, also referred to as an EOB, a legally authorized representative, and a variety of other available resources. Here are some of the documents you may have already received. Save these materials along with your other records because they include important information you may need to reference from time to time. The first is the Plan Confirmation Acceptance Letter. We'll send you a letter once the Centers of Medicare and Medicaid Services approves your enrollment. This letter will include information to help you understand your plan's features. If you choose a plan with a monthly premium, you have three options for paying for it. First, you can have your premium automatically deducted from your Social Security or Railroad Retirement Board benefit check. Another option is to have your premium automatically deducted from a checking account using the electronic funds transfer process. EFT is safe, convenient, and saves you money on postage. The third option for premium payment is to use the coupon payment book. Instead of receiving monthly invoices, you receive a payment book with 12 monthly coupons at the beginning of the year. The coupons are pre-printed with your name, account number, payment due date, and amount due. Each month, you can mail a check with a coupon from that payment book. For more information or assistance with bill payment, please call the member service number on your ID card. They'll be happy to help you. Your evidence of coverage offers a complete description of health and prescription drug coverage, requirements, and member rights under your Medicare Advantage plan. When using your plan benefits, always use your member ID card, not your red, white, and blue Medicare card. The member service phone number is on your ID card. If you ever have benefit or claims questions or concerns, please call us. You'll get an explanation of benefits every month that you've received healthcare services. Keep in mind, the EOB is not a bill. This is a monthly report of claims we have processed. It lists what care you have received, what the plan has paid, and how much you have paid out of pocket or will be billed. If you owe anything, your doctor or other healthcare provider will send you a bill. A separate report is provided for Part D prescription drug coverage. You'll receive a single EOB when we make a payment directly to you, and you'll get a monthly statement that shows all of your claim activity for the month before. If you notice something suspicious that might be considered dishonest billing, you can report it by calling 1-800-MEDICARE 24 hours a day, 7 days a week. You can access your EOB online at your secure website at www.member.cvty.com. The cover page shows your name, address, and any informational messages from Coventry Healthcare. If you ever have any questions about your Coventry Medicare plan, the number for customer service is located here, circled in red. This is your member information section. Here, you'll see your name and member ID number. Always have your member ID handy when you call us or use your online tools. It's an important piece of information we require to protect your privacy and healthcare security. In the box on the right, you'll find the phone number to call our Member Services Department with any questions about your plan. This section shows the details of the claims we received and processed for the month, as well as the entire benefit year, January 1st until now. This information includes what amount the healthcare provider billed us, the amount your plan approved, the amount your plan paid, and the amount you need to pay. People sometimes get confused when they see a billed amount that is higher than the amount the plan approved. The Coventry approved amount is determined by our negotiated rates with network providers. These doctors and other healthcare providers have agreed to accept this amount as payment in full. This is the protection you receive as a Coventry Medicare member. You don't have to worry about paying more than your Medicare plan's approved amount for in-network healthcare services. As you can see, there are two amounts circled in red. The top circle shows the amount you owe for all claims listed on this EOB. The bottom circle tells you the amount you have paid in these claims since the beginning of the year. The deductible and yearly limit section explains the out-of-pocket costs associated with your Medicare plan. If your plan includes a deductible, you must pay that amount before your coverage begins. The box at the bottom left indicates the total amount you need to pay to meet the deductible and how much you have spent to date, shown here in the red circle. If your plan does not include a deductible, you will not see this box. The box to the right tells you the most you will have to pay out of pocket for medical services during the calendar year, January through December. The great news is that there's a limit on how much you pay, but not on how much care you get. Once you reach your maximum out-of-pocket amount, you stop paying for services, except for any premiums or other services indicated in your evidence of coverage. The plan will pay the full cost for any covered services for the rest of the calendar year, giving you financial protection and peace of mind. The bottom half of the big box in red shows the maximum out-of-pocket costs that apply to your plan and how much you have accumulated toward this amount to date. There is maximum out-of-pocket for in-network services and another one for out-of-network services. The out-of-network maximum is higher than the in-network. This reinforces the value and savings you get when you use network doctors, hospitals, and other medical providers. This section shows the details for claims we have received and processed. It includes a description of the services you received, what the healthcare provider billed us, the amount approved by the plan, the amount the plan paid, and the amount you need to pay. Make sure you have the claim number, circled here in red, if you need to call us with any questions. Sometimes there are cases when we may deny a claim, and there are some things to know if this happens. Here's an example. A member uses his new plan ID card before his new benefits start January 1st. We would deny a claim because that member was not covered under a new plan on the day that he received treatment. What's the moral to the story? Always check your ID card. Make sure it's effective for the current plan and benefit year before you use it. If you still have your card from last year, cut it up and throw it away. Now, if we deny part or all of a claim, we'll send you a letter called the Notice of Denial of Payment, explaining why we didn't cover it. You then have the right to appeal. Making an appeal is a formal way of asking us to change the decision we made to deny your claim. The letter tells you what to do if you want to appeal our decision. If you do not have this letter, call our Member Services Department at the number on your ID card and they can help you. You can also access an appeals form online at www.member.cvty.com. Some members choose to purchase additional benefits called optional supplemental services like added dental coverage. You will only see this information if you have selected this type of coverage. You can designate a legally authorized representative to assist you or handle affairs related to your healthcare services on your behalf. This can be a family member, friend, caregiver, or power of attorney. Call the Member Services number on your member ID card and find out how to designate your authorized representative. Some say Medicare is like a foreign language to them. That's why our Member Services Department is available to address your questions or concerns. Here are some of the ways they can help. Answer benefit and claims questions, find network doctors, hospitals, and pharmacies, get referrals for care, change addresses and phone numbers, update your choice of your primary care physicians, replace ID cards, designate a legally authorized representative, access translation services, resolve concerns, and much, much more. In addition to the Member Services phone line, you also have access to a secure personal website. This resource includes your health and claims information and much more. Your personal website can be useful if you want loved ones to assist in managing your Medicare coverage. With your authorization, Coventry will provide your representative with online access to services that help you find a doctor, search our drug list, check plans and coverage costs, get a new ID card, access wellness tools, and sign up to receive documents electronically. Here are some easy steps to become an active participant in your health care. Read your plan materials and store them in a safe place. Visit your secure website at www.member.cvty.com. Use network providers to get the most value from your plan benefits. Always use your Coventry member ID card and call Member Services when you have a question. We want to give you the coverage and care you need to stay healthy. Please tell us how we're doing so we can provide effective, personal service. We appreciate your interest in learning about your member materials. Thank you for being a Coventry Medicare member.